Hi, I'm Sam Butler. I'm a physician here at Epic. The electronic medical record might seem like a barrier to high-quality patient interaction. But what if you could use the EMR to educate and communicate with your patients while simultaneously getting your work done in the exam room? If you are new to using an EMR during patient visits, focusing on the patient while documenting and ordering can take some getting used to. We asked several experienced Epic users for their insight. Take a look.
So I would introduce myself like I always do, shake their hand, introduce myself, and then I would usually sit down at the location I am now and explain to the patient that I'm going to sign into your chart and we're going to review a few things together before we get to your your presenting problem for the day.
But I just will do a small blurb telling people that I'm going to talk to them, and at the same time I'm going to be doing some work in the computer so that they know that they have my full attention, but that I may look away from time to time.
Well, it's not only important to position the monitor, but how do you position your body? Because the last thing you want to do is turn your back to the patient.
We're very proud of our desk configuration that we call angle to patient. We can be interviewing the patient. They almost don't know that the monitor's there. In fact, they usually said that the physician was maintaining eye contact with me, when in truth the physician was maintaining eye contact with the patient and the computer.
I'd like to sit in a triangle with the patient. I'll sit here and the patient will sit across from me, and I'll have the computer with the screen over here so that again I can divide my attention in whatever way is necessary. At the same time allowing the patient to see if I'm doing work or looking at things, what are the things that I'm doing or looking at.
If they haven't really been seen in our system before, then I'll have to type in the patient's past medical history, surgical history, and truly populate the chart a little bit more.
We go over their problem list together. We go over their history section, so the whole history tab, both their social history, we put in the free text section, we put in their new employment, we update the ages of their kids. We do all of that, their surgical history, their past medical history.
I really don't withhold anything from the patients. It's their medical record and their health record. I think they should be able to see what I'm typing and what I'm looking at.
Actually, I kind of promote it as I'm sharing this information with you so you can help me correct your chart and make it as accurate as we can together. And patients seem to like that. So problem list, medication list, allergies.
When it comes to new diagnoses, I would never want a patient to find out they have a new serious diagnosis by seeing it on something like that. So I might hold off on putting a sensitive diagnosis on their list until such time as I've been able to discuss it with them personally.
What I found out with, obesity, morbid obesity, pediatric BMI greater than 95th percentile, all of those, nobody that you talk to them about their weight is shocked that they're overweight or that they're obese. And so just letting them know what the medical definition is and showing them their little BMI chart graph, and that it's just like saying hypertension, diabetes, asthma. It's a clinical diagnosis and it's not judgmental.
We do a lot of huddling and pre-visit prep so that we have a good understanding, hopefully, of what that patient needs and what they might need that they don't know that they need before they even enter the building. So we're doing a lot of prep work, and we have reports based on that to show us what health maintenance gaps do they have. Do they need immunizations? Are they overdue for this or that or the other thing?
They do med reconciliation, they tee up med refills, and they do a lot of things with preventive screening.
So if I need to communicate with my CMA or my LPN, my rooming staff, there are certain orders like EKGs and immunizations and other in-clinic procedures that when I sign that order, it will cause the multiple provider schedule to pop a blue dot up next to that person's name. So if they see a blue dot pop up and they see EKG, they can get prepped for that while I may be spending another 5 or 10 minutes in here with the patient.
I absolutely do the orders, and this is very important because they're going to go down to radiology or to x-ray, and the last thing you want is somebody going down there and not having their orders in the system.
If it's fairly straightforward, I personally don't mind typing my subjective as we're talking. You know, like, do you have any fever? No fever, and I'll be typing that in as I go. And that way, that portion of the note is already completed by the time I walk out of the room.
We have really good notes and smart sets templated out for things like physicals, and those are heavily utilized because they provide structure and also a measure of decision support by running providers and other staff through lists of things that they should be covering at those types of visits.
Also, when we're going through like their past medical history and their surgical history, we can help kind of tee that up. And it's like, oh, I saw you had your gallbladder out, but I don't have a date down. Do you remember when that was? And they can kind of help fill that information in for me.
Patients absolutely love to have written patient instructions. They would relax for a few minutes, I would type that out. Then I would turn the screen to the patient, and the first few times I did this, they would grab their purse to get out a pencil and paper, and I would say, oh no, you don't have to take notes, we're going to give all this to you in writing. So they've got everything there for patient instructions, and then it's on the ABS. One nice thing about Epic as an educational tool is that it's easy to make graphs. So if we want to give positive feedback to a patient about improvements in their diet or taking their statin medication, what benefit that's had, we can show their LDL cholesterol and how that's coming down.
I usually will put something in the after visit summary, depending on if they're a MyChart user or not, that I can print out. And often I will turn the screen. If there's some sort of exercises for your shoulder pain that I want them to do, I will put that in their patient instructions, turn it towards them and say, well, here are the exercises that I want you to do, because there's pictures. And then if they're MyChart users, you don't necessarily have to give them the paper, because they can see that afterwards by themselves when they log back on at home.
Sometimes in terms of laboratory results, sometimes I'll show them trends, if things are getting better or worse, so that they can kind of see how things were the day before and the day before that. Sometimes, depending on x-rays too, if there's something that I really feel that they would have a better understanding of by actually looking at the picture, then I'll show them an x-ray or maybe even EKG.
As I'm kind of populating the different areas of the visit, I kind of review with them and say, well, here's what I diagnosed you with today. And then if I populate that patient instruction section with something I want them to remember, I might review that personally with them right now. I may print it out and highlight it and bring it back into them. Usually if I order any medications or labs, I'm turning the screen towards them again, involving them in the visit again, and then saying, well, here's what we're going to do now. It helps things click, and it's not me doing this and saying, okay, you're all set, go to the pharmacy, and they might not quite understand what everything was at the visit.
Logging out of Epic is a really nice reminder to them that their appointment really is concluding. It's the old hand on the doorknob trick, but the logging out of Epic really does seem to give them that clue that we're now concluding.
Independent from the EMR, I'll just explain to them my thought process. And that sometimes and oftentimes is the end of my interaction with EMR that the patient is aware of. Well, I probably would have paid even better attention to my training when I was getting started right away.
Having patience is, I think, important. That it is a big change, but it's for the better.
Being afraid that your inability to use the technology will make you look like a fool in front of your patients. Patients get that technology is kind of scary, and quite often they appreciate that fact of vulnerability in their provider.
Used to think the problem list had to be pristine. You can invite the patient in to look at the problem list, and they're not going to get upset that there's something on there that is 4 years old and should have come off, that they're willing to kind of help you clean house.
And anytime that you want to add something to that problem list, just do it right when you're thinking about it. And it allows your team members who might be taking care of your patients when you're not available to have a really good sense of who your patients are.
Just don't be afraid of it. You can't really break it. Trust me, I've tried.
Just finding the time on the front end to just help customize it the way I wanted it to be. Once you get comfortable with it after a month, then you can get more information, optimize again, get more information, customize a little bit more, and then keep working on it.
So I learned Epic in a classroom full of other residents with a screaming 2-week-old. So if I can figure out a computer based on that, anybody who has been trained in Epic and actually paid even an iota of an attention to their training will be just fine.
Smart phrases allow you to standardize the work you do. I think it also allows you to save a lot of time, but also to customize things to the way that you want them. It definitely increased my efficiency, because the way I used to do it on paper is that I would essentially create my template and then I would fill it in. And so now my template's already created by 2 seconds of typing in a smart phrase, and then filling it in is about the same.
I can, using a dot phrase with a flick of a few fingers, bring that entire patient instruction into my note, into my SOAP note, and that's the plan.
When you're using an electronic medical record, you should never write the same thing ever twice. Because if it is something that you wrote twice, you should have created a dot phrase or a shortcut for it.
We took the time ahead of patients showing up on day one to abstract a lot of that information in their paper chart already into their populated electronic record. Because the last thing I think you want to do is to, start your first day without any of that information in there and starting with a completely blank slate.
It's the best way to train is in production, because then the next time you go to use it, it's right there. You don't have to rebuild your smart phrases and your dot phrases and your stuff, your flow. It is right there the next time you use it.
It's been described that it's easy to dump a lot of tasks back on the providers. When you get onto an electronic medical record, it's very easy to do that. And so it's been a process of trying to intelligently claw back those things so that providers are working to their credentials and doing provider-related tasks that only they can do. And by reasserting sort of that, we have a higher, more efficiently functioning machine.
We will have periodic user meetings, I guess, so all the providers will get together, usually after clinic one night, and I will lead a little session about Epic, and just from talking about one instance can often stem dialogue about, well, how do you do X? How do you do X? And other people will say, yeah, I don't know how to do that either. And then one person says, well, I know how to do that. And so we bring up the EMR or a test patient on the screen and say, well, watch what I do. And everybody goes, oh my gosh, that's so good. I haven't been doing that. I've done this roundabout way. And so all these kind of sharing sessions have been really beneficial.
In summary, one of my favorite tips is to always make the patient the focus of the visit at first. Introduce yourself and then take time to introduce the EMR as a tool that's going to help you take care of the patient, and ask if they'd like to watch you as you use Epic. Position the monitor toward the patient to maintain interaction, learn efficiency tricks, and lastly, set expectations with your staff regarding what they should do to help you make your time with patients most efficient. Keep these tips in mind as you continue to learn how to use Epic, and good luck in your training.